Hello, my name is Tom Downing, and I am in my first semester at the Touro College School of Education. This video is for my Intro to Teaching Students with Disabilities, SpEd 602 course. Professor Stephen Levy is the instructor for this course. The topic I chose for this video presentation is Attention Deficit Hyperactivity Disorder, or ADHD. ADHD is a medical disorder or condition that affects a person's ability to regulate behavior and attention. I picked this topic because it has been a part of my life for years. Two individuals in my family were affected by this condition throughout their childhood. Although they have both successfully overcome the challenges and barriers associated with ADHD, I have seen firsthand how difficult the disorder can be to live with. The following presentation will attempt to give viewers a better understanding and knowledge of attention deficit hyperactivity disorder. Attention deficit hyperactivity disorder is a developmental disorder which involves inattentiveness, overactivity, impulsivity, or a combination of all these problems. It is the most commonly diagnosed behavioral disorder in children. It affects about 3 to 5% of school-aged children. This disorder is also diagnosed in young boys much more often than young girls. ADHD is a problem of performance, not a problem of knowledge. Basically, this means that children with ADHD are smart enough to perform on a normal level, but behavioral factors such as inattentiveness, overactivity, or impulsivity, as I mentioned earlier, deter them from such achievements. ADHD is also considered a chronic disorder. 30 to 50% of the individuals diagnosed as children continue to see the symptoms into their adolescent and adult years. What are the symptoms of ADHD? The symptoms of attention deficit hyperactivity disorder are categorized into three groups. These three groups include inattentive symptoms, hyperactivity symptoms, and impulsivity behavior symptoms. To be diagnosed with ADHD, a child must have symptoms for 6 or more months and to a degree that is greater than other children of their same age or level. The first group of symptoms I will discuss are inattentive symptoms. One feature of inattentive ADHD is that children make careless mistakes in schoolwork and fail to provide attention to detail. The attentional mechanisms in their brain are inefficient. These children have great difficulty concentrating on tasks such as schoolwork or homework. Their work often contains careless errors and shows lack of attention to detail. They also struggle to maintain focus or attention in the classroom setting and usually learn better in one-on-one situations. Inattentive symptoms also include task impersistence or failing to finish schoolwork. This greatly affects test-taking skills and overall academic achievements. Children are also very disorganized and have trouble following sequences without adult supervision. The last symptom of inattentive ADHD is forgetfulness. Students have many difficulties recalling what they learned, following instructions, and often misplace items of importance such as homework or family valuables. The next group of symptoms I will discuss are hyperactive symptoms. One characteristic of hyperactive ADHD is the constant fidgeting of a child's hands or feet. These children are always moving around in situations that do not call for it. They have difficulty just sitting still in the classroom throughout the day. Hyperactive symptoms are usually due to a child's lack of self-control. Overactive behaviors are also symptoms of hyperactive ADHD. Some children continuously run around at inappropriate times and cannot remain seated for prolonged periods. Another hyperactive ADHD symptom is being overly noisy. Children will blurt out inappropriate comments or answers to questions, make repetitive noises without being aware of it, and just continue to talk excessively with other classmates, which is disruptive to classroom activity. The final group of symptoms I will discuss are impulsivity symptoms. Children who display signs of impulsivity are very impatient and find it difficult waiting for things they want or even waiting their turns during a game. These symptoms are also including blurting out inappropriate comments or showing extreme displays of emotion without restraint or care of the consequences. Another symptom of impulsive ADHD is interrupting conversations or other activities that parents or classmates may be having. In many cases, difficult children are incorrectly labeled with ADHD. On the other hand, many children who do have ADHD are undiagnosed. The American Academy of Pediatrics issued guidelines to determine if a child has ADHD. These guidelines read: 1. Children should have at least 6 attention symptoms or 6 hyperactive or impulsivity symptoms, with some symptoms present before the age of 7 years old. 2. The symptoms must be present for at least 6 months, seen in 2 or more settings, and not caused by another problem, disorder, or illness. 3. The symptoms must be severe enough to cause significant difficulties in many settings, including home, school, and socially. In older children, ADHD may be in partial remission when symptoms are present but no longer meet qualifications of the disorder. In this case, children should be evaluated by a doctor. This evaluation should include things such as parent and teacher questionnaires, psychological evaluations of the individual and their family, including IQ testing and psychological testing. And also, it should include a complete developmental, mental, nutritional, physical, and psychosocial examination. Treatment and medication. Treating ADHD requires a cooperative process including healthcare providers, parents or caregivers, and the child itself. Successful treatment involves a combination of behavioral therapy or psychotherapy and medication. The most common type of medication used for treating ADHD is called a stimulant. There are many medications that can be used to treat ADHD, including Ritalin, Concerta, and many others. Behavioral therapy is used to alter a child's behavior patterns and teaches a child how to monitor his or her own behavior. Current treatment programs focus on reducing symptoms of ADHD and improving a child's daily functions. The best treatments include a combination between medication, various types of behavioral therapy, education or training on ADHD, and parental or family involvement. ADHD in the educational setting. If a child is thought to have ADHD, the school may conduct an evaluation to determine whether the student qualifies for special education services. However, Not all children with ADHD are eligible for special education services in New York City public schools. If special education services are needed and the child is eligible under the Individuals with Disabilities Education Act, the school district must develop an IEP, or Individualized Education Program, which is specific for the child within 30 days. Students with ADHD perform better academically when routines and structured activities are involved in their daily lessons. Additional support is also available in schools from teachers, school counselors, the school support team, behavioral therapists, and speech pathologists, who all help students with ADHD in their daily activities. Facts about ADHD. Next, I will discuss the few major facts about attention deficit hyperactivity disorder and how they affect citizens all over the world. Researchers believe genetics play a large role in ADHD. 30 to 40% of children who are diagnosed with ADHD have relatives who also are affected by the disorder. According to the National Institute of Health, ADHD is one of the most common mental disorders among children. 3 to 5% of all school-age children are affected by ADHD. Boys are diagnosed 3 to 4 times more often than girls. Boys also show signs of hyperactivity, while girls affected by ADHD show symptoms of inattention. Adolescents treated for ADHD with medication reduce the likelihood of substance abuse by 85%. Components of ADHD result in social problems or rejection, poor academic performance, depression, anxiety, and extreme stress levels. Now I will show a short video on ADHD.
ADHD stands for Attention Deficit Hyperactivity Disorder, and it's one of the most common disorders that we can see in childhood, and it's characterized by problems with inattention, hyperactivity, and impulsivity. It's important to note, though, that there are different types of ADHD, and one of the types is characterized by primarily having difficulties with hyperactivity and impulsivity. Now, this is the classic type that most people think about when they think ADHD. These are the kids that are bouncing off the walls, basically. They have a really hard time sitting still, hard time staying in their seat. They may be impulsive and disruptive. They may blurt things out, be very impatient, and basically have a hard time putting the brakes on. Now, these kids are usually identified fairly early because they tend to attract a lot of negative attention and cause difficulties like in the classroom and that sort of thing. There's another kind of ADHD that's characterized primarily with problems with attention. There may be a little bit of hyperactivity or impulsivity at times, but the inattention is really the thing that's causing the most difficulty. And these are kids who are often described as having problems with daydreaming, being spacey, kind of lost in their own thoughts or kind of tuned out. And these kids actually may go missed or may not be identified early and may not be caught until later elementary because they're not drawing a lot of negative attention to themselves and they're kind of in their own little world sort of thing. There's also a third type of ADHD which can be a combination of both of these things, where there are problems with inattention and with hyperactivity and impulsivity.
Thank you for watching.